Cancer has long been considered a disease of aging, but that assumption is being increasingly challenged by an unsettling trend: the rise in cancers diagnosed in people under the age of 50. A new, sweeping study conducted by the National Cancer Institute and published in Cancer Discovery paints a troubling portrait of this development, analyzing more than 2 million cases diagnosed between 2010 and 2019. The data is alarming. While early-onset cancer, defined as cancer diagnosed between ages 15 and 49, remains relatively rare, its increasing prevalence is unmistakable and potentially dangerous in both short and long-term terms for public health. The most striking findings concern specific cancer types. Breast, colorectal, kidney, and uterine cancers are leading the surge, with breast cancer showing the highest number of excess cases compared to expectations based on 2010 trends. This uptick translates into thousands of additional people in the prime of their lives being confronted with a disease that upends their careers, families, and futures. The societal costs are massive, not only in healthcare dollars, but also in lost productivity and emotional burden, costs that will only mount if these trends continue unchecked. While some experts have rushed to offer plausible explanations, such as improved screening, rising obesity rates, and changing reproductive behaviors, none of these theories fully account for the breadth and speed of the changes. The truth is that we are confronting a serious gap in understanding. The current databases used in the study do not include critical information about environmental exposure, diet, stress, sleep disruption, hormone-disrupting chemicals, or even access to timely health care. Without this context, the findings, while robust in raw numbers, are still frustratingly incomplete. There is growing concern among oncologists and epidemiologists that we may be underestimating the complexity and urgency of this issue. What makes this even more concerning is that the increase is not limited to one demographic. While about 63% of the early onset cases were among women, suggesting some gender-specific risk factors, the upward trajectory spans across sex, race, and regions. This hints at a more systemic, possibly environmental or lifestyle-based shift affecting the broader population. It's not just who gets cancer, but when they get it, and why the timeline is moving earlier. We are potentially witnessing the long-term effects of cumulative exposures, whether to pollutants, sedentary lifestyles, processed diets, chronic stress, or other yet unidentified triggers that began decades ago and are now manifesting. Although some might find solace in the fact that death rates for most of these cancers have not increased substantially in younger adults, that comfort may be misleading. The data still showed rising mortality for colorectal, uterine, and testicular cancers. Even when cancers are not fatal, early onset brings its own form of trauma. Younger patients face aggressive treatments while balancing family responsibilities, financial stress, fertility issues, and long-term side effects that can last decades. Survivorship in this age group is not merely about living, but about living with the enduring shadow of cancer. Recurrence, secondary cancers, mental health struggles, and chronic fatigue. The fact that more than a dozen cancer types have shown a decline in this age group is encouraging on the surface, but doesn't reverse the broader concern. Declines in lung and prostate cancers, for instance, are most likely attributed to reduced smoking and changes in diagnostic guidelines, not to an overall improvement in health conditions. These declines may give a misleading impression of progress, diverting attention from the worrying patterns that are growing elsewhere. Perhaps most alarming is the possibility that we are only seeing the tip of the iceberg. Cancer has a long latency period, often taking years or even decades to develop after exposure to a carcinogen. If the contributing factors have been accelerating over the past few decades, be it due to ultra-processed food, endocrine disruptors and plastics, or even unknown variables, we may be in the early stages of a much larger public health crisis. By the time the full picture comes into focus, it could be too late to reverse the trends for an entire generation. The medical community has called for a large-scale meeting later this year to tackle these troubling findings, but that alone will not be enough. There must be a concerted investment in targeted research, including longitudinal studies that account for lifestyle, genetics, geography, environmental exposures, and access to care. Without such comprehensive investigations, policy changes and prevention efforts will remain hamstrung by guesswork. This is not merely a scientific question. It's a national health emergency in slow motion. If early-onset cancers continue to rise at this pace, the health system could be overwhelmed by long-term care demand from younger patients living with chronic or relapsing forms of cancer. This demographic shift could place enormous pressure on insurance systems, workforce productivity, and mental health services. We are rapidly moving toward a world where the cancer burden begins earlier, lasts longer, and affects lives at their most productive stages. We must face the hard truth. A younger cancer population is a warning sign, not just a statistical curiosity. Without urgent, coordinated action, what is now an emerging trend could become the new normal, one we may deeply regret not addressing while we still had the chance.